All right, so David came up today and he's tell me he got this pain between the shoulder blades. Can you point it out? Turn around and point it out.
Right around here.
Right about right in here.
Yes.
And can you describe that pain?
When I bring my arm back, I can't go too far back to the right without feeling that it kind of pinches somewhere in here. In
Okay.
the back.
So what's happened? Sometimes people come in and they think it's between the shoulder blades, and of course people start digging there with elbows, trying to work around. But as they know that pain ligaments and referral pain, they might be know this is sometimes it's come from the cervical area. And what we're going to do, we're going to test, of course, the shoulder, the neck, and see what's going on, the problem up here, maybe some compensation. But definitely, I'm not going to jump on those rhomboids and try to stretch them because I think that's the problem. I'm going to work all around. So let's do that. Let me drop this book off. And I'm going to start testing the neck. To test the neck, go ahead, put your feet together, stand up. I think you step like this. Put your feet together.
Together.
Yeah, come on, always feet together. When you're testing, your feet together. So what I want to see how his neck is turning. I want him to turn to the left. And I'm looking for like around 80 degrees. Correct. You see, he knows. But he's let me see if I can help you. Yeah, you see, he's kind of. So he got 45. Something's stuck in the neck. Let's turn to the right. Right is much better, right?
Mm-hmm.
You can tell. So the right is much better. See, he can turn without any problem with the compensation. But when he turned to the left, it's some pain, and he's so limited. Can you go look it up as much as possible? He's a little bit short on the extension of the spine, so his cervical can extend. Can you flex? And he can flex. So usually this is like already giving us the suspect something going on where, turn for the camera, it's in here. It could be a C7, T1, and that pain also can be referral from that C3, from the nerve from your neck. Now, what I'm looking for that posture. Look at that shoulder, how that shoulder is high. You see that shoulder? He shrugged that shoulder. You can see it. You can see it on this camera. Yeah, you turn back, but look at that shoulder. He's like this. He's shrugging that shoulder. He also can be push on that brachioplexus nerve, and that could be the problem. So what we're going to do, let's see that shoulder mobility. Go ahead and squeeze your thumb together and try to reach behind you. Yeah, look at that distance. Go switch. And look at that. You see how when he's doing that, his head is coming on the side. So he do compensation. He can reach behind his head. When he's trying to reach behind his head, he have to lean forward to reach behind. So that means something going on. It's thoracic mobility, shoulder and neck together. If you're just gonna treat that area, it's my help for a couple hours, or maybe a day or two. But then if he come back, he's gonna do the same problem over and over and over again. What we're going to do, we're gonna work on David, and we start with the neck. So go ahead, lay down. Able, and remember, I'm start working on not exactly on that spot. And people who first time meet me, they usually like, oh, why you don't work on that painful spot? Because I know the problem is not there. But of course, I usually start with a painful spot for 5-10 minutes. But in an educational purpose, I'm just telling you, start with a painful spot, even if you know its problem is not there. But what we're doing here, we want to check that neck again. So we want to get this. Check the flexion and rotation. We bring this in the flexion. We're checking rotation of the neck right now. Ask him to turn around. And it's, how's it feel? Good?
Yeah, feels okay.
Now turn to the left. And that's a limited, so it's stuck. You probably see on the camera right here. We're gonna add more, but this is stuck. And I'm trying to help him. Let's see if I can go a little bit even further, and I'm stuck up here. So we got this problem on the left side. Now let's check and I can feel it. You feel that? I'm already feel that bump on the left side of his, C3, C4 is right in here. It could be sensitive too. I always check that laminum groove and see if anything push me to the side, my finger, and start working. Okay, so next test is gonna be, we're gonna do a rotation and try to tuck your chin. And it's not going. So I don't wanna even do this because it looks like it's painful for him. To the right and tuck your chin. And this one is a little bit better, but it's still stuck too. So could be OA joint. It could be the lower portion of the neck, with the stiffness, that douch hump, when that head is shit forward. Could be that problem too. But what I'm gonna do, I'm just gonna work on that neck and see if I can improve. I'm gonna work on that neck and that left shoulder and see if I can improve this rotation and at least eliminate that pain, which is possible. And the first thing always start with decompression. I grab the neck, I'm coming right in here. You can see my big thumb, it's get close to the neck. I'm not trying to choke the person, I'm just grab it, and all I do, I just pull him with my body. Pull, I can pull, hold, I can do some movements. I do not add side bending. I see a lot of people start do side bending. We don't want to do the side bending. I don't know where this come from. If you see the neck, how the neck designed, those vertebrae, you don't want to do side bend. Maybe slight one, but not like crazy. I see people doing this big stretch. No, you don't want that. Okay, so, and you can do this many times till the client is relaxed. I'm also wanting him to relax and breathe. Exactly. Now he started let it go. And look at this shoulder, how high this shoulder is from the floor. It's because he's like this, especially that one. And look at this. This shoulder is bigger than this one. This is more skinnier. Yeah, so you always pay attention to this. My nose is itching. Here we go. Now I want to work on that laminum. I'm gonna rotate this so that whatever he can go, he's not go a lot. And all I do, I'm gently glide my finger down that laminum groove in the cervical area. And if I feel there's something pushing me or something like not right, I always ask questions. Are you doing okay? Is now no pain?
No, feels good.
Exactly. With neck, we always work gently. We don't do all those crazy movements. And my speed is a little bit faster. I go very slow. This is double speed up because you guys don't want to watch that slow more work. But for your practice, you need to go super slow. And next one, I'm apply that finger to lamina, and I do just kind of lean back. So if one of that vertebra pops, it's gonna pop back. Do I use a lot of force? No, I don't want to do any. How does it feel?
It's good.
It feels good. So you see what I did? I rotate it to the left and kind of bring a little bit here, and I start using that. So rotation, slight side bending, and I just move up and down so that finger is coming that way. Good. I'm gonna start switch to the right. Here we go. Very gently. I want to work both sides, For the video purpose, I can just show you the right one and it should be good, but I want to truly help him and make sure that neck is going to turn. How's it feel?
It's very relaxing.
Good. Here we go. Pressure is okay?
Yeah.
Exactly. So always ask. Sometimes people get this inflammation in the neck and it's very sensitive to touch. I have this 75 years old lady, and it took me like 10 minutes to just at least start touching because he got so inflamed. It's took me 10 minutes to make sure she's relaxed because she was in pain. So again, side bending, move. There we go. Nothing click yet, but that's fine. Some people looking for this click adjustment. No, it's not necessary. Here we go. Next one, remember he can turn to the left a lot. So I want him to take this first barrier So he's right here. I'm applying slight pressure to the left. Now you're gonna open your eyes and you start to look left and right. So all he do, he's try to look left and go. Guess what? When I'm start holding him, his jaw is moving too. He can feel it. I'm kind of hold the jaw too. Only his eyes is looking left and right, left and right, left and right. And now go ahead, look to the left, always to the left, and then try to turn a little bit more. Pain? No? Good. So what he's doing, we add our deep six muscles in our eyes. Sometimes they stuck, and the person wasn't look much to this left side because the eye muscle was tight. And guess what? It's also jammed the neck. So always check those eyes. And I'm go back to massaging again that back muscle, splenius capitis, also this posterior scallions muscles, mid scallions, very gently and nice. Yeah, people say, oh, it's a triangle, it's a nerves up there, an artery. Yeah, just be gentle. And if you grab something you feel pulsation, or clients get this negative feedbacks, just stop doing that. Very gently. That's why I'm not rush myself. And I'm not doing this. And yeah, I see people doing that. On the championship for massage therapy, the guy doing this. And I'm like, why? Why are you doing this? It's a neck. Okay, sternocleidomastoid is an important muscle. You bend to the side, which is you working on. So working on the right side. I want to bend to the right side, and I start squeeze that muscle up. David today's get a lot of massages. What a day, David, huh? Yeah.
That's good.
So I scoop it up and release. And of course I switch sides. This is probably going to be more important to work on. I can feel this resistance. So I turn. You can do also muscle activation. You can use the band, you can use your arms. My favorite one is when people start resisting against your hand. So I'm going to show you on the right one what I mean, but I have to do this on the left side. So when you come in, you drop that shoulder down. You see my one arm, this one is dropping down, and I get this hand right by his head side. And what I'm doing here, I'm asking to push against my arm. No, against my arm, you by your head. So he's trying to rotate it. So you try to go the side bending
with my head.
With your head, yeah. With your head. And what he's doing, he push against me. What he's doing, he's activate this muscle. And relax. Now I want you not just to push side bending, to try to rotate. So try to rotate your head to this arm. Yes. That shoulder, I'm just drop it down. Try to rotate. So basically I'll rotate against my head. Here we go. Now it's probably better. Try to rotate. And let it go. Now again. Side bend, try to push against my arm. And I'm just doing this kind of relaxing. And let's do right side. So left side, sorry. So exactly, you see I push that shoulder down. I'm use my body weight is right there, and he push against me to the left. And if any pain present, he's going to tell you right away. Feel okay? Good. Push, keep pushing. You can do the ball. I can do ball against the wall. Some people lay down on the bed and push against the ball. It's yeah, you just activate your muscle. And all you do, start rotate it. Try rotate to the left, Right. Yeah, you start rotating. And this is what I'm doing here. You see that clavicle, oof. Try to relax. Next one, I found that clavicle bone. This is the tuning fork. I come up here, and you see I grab that neck. I'm not choking, I'm not putting the neck. And all I do, I kinda, very gently, get this together. So this is my motion. I know the chiropractor, they do very powerful force. All you need to do, just very nice springing. Doing okay?
Yeah.
Relax, let it go. He's trying to control that head. So yeah, and let it go. Switch side. I'm gonna show you from this one. So you rotate first. Find that the big thumb is coming under the C7 T1. That where's that hump is start, and you start doing this. So what I'm doing here, yes, very gently. Okay, here we go. You feel that click?
Mm-hmm.
Something click in his clavicle. So we shifted. Definitely, we did something good. We'll see if he's turned, and let it go again. Decompression, spine decompression. Ask him to turn again. Very slowly. See if this is, yes. I come back and work on that laminum groove again. So what I'm doing here, I'm gliding my finger. See, I rotate the head, a little bit side bend, and get that big thumb right in that lamina. And I'm just gliding down, and if I feel there's something on my way, which is vertebra, could be twist, which is usually happen, I'm just work on it and gliding down and up. So this is what I'm doing here. Okay, I'm already show you this way. Rotate, side bend, lamina is up here, and all I do this way. See, I'm going down, all the way down, and start from the top. I'm not pushing right in the behind my occipital area, because we know this artery up there and nerve, occipital nerve, so we don't want that. We don't want push on that. If you want to work a little bit on the side, is work on the side. Also great exercise, great position for work on TMJ. And this is about it. Like I said, neck, I usually do 15 minutes max, and give them the homework exercise so they can truly work at home and understand why you need to make sure this neck is rotated. All right, let's do the shoulder. Okay, muscle rep is not here, that's fine. And as a physiotherapy, a physio massage, we don't use a lot of oil. We don't spread on people gallon of oil. So the pec muscle could be really restricted, and you can see the shoulder is very high. So what I'm doing here, I'm get that pec muscle just open up. I'm not pushing too hard, and I'm gliding down very gently. I can apply. You see my hand is straight. I'm apply pressure down, and it just kind of make him a little bit move. And after, I'm gonna truly dig in there. For the woman, the same. If the woman just try to get that breast down with the sheets, apply under the scapula, and this is the grip. So this is the forearm. The forearm fascia, you see, because my forearm fascia is really good grappling. So you see, I'm scooped, and I can move the whole body. You see his head is moving. Everything is moving. So I grab that fascia and I start dragging medial to lateral away from the body. And what he's doing here, we already showed this many times. He started rotating this arm, shoulder in and out. Yes, make that muscle work. I'm truly to show you have to work on that right shoulder, but the problem is here. Rotate it. I'm gonna get up there. And let it go. So, yeah, let me just work a little bit on that one, and I will start live streaming on TikTok, and we can guys do that shoulder for you, for the camera. So that's about it. You see, I'm truly mobilized that. I'm up here, move. I give this motion. I can move him, that shoulder, and he can rotate by himself. Exactly. Rotate. This is the beauty of the manual therapy. Okay?